So, J.K. sir, you have rightly said the title of this talk is very nicely worded. It says needs and need gaps in cancer care. What are the expectations and from doctors and from all of you? That's exactly what I'm going to tell you. And from the radiation point of view, some of the things may be common to all the oncologists. I'm a radiation oncologist. I use radiation to treat our cancer patients. And whom do we see? Actually, it's a patient. So it is an interaction which happens between the patient and us. And in between these two components, we have a middle person, and with a very, very important component, and is a NGO, like all of you who is there. And here, our expectation is what? There are about 4 or 5 areas that we can really see where you can really help us. One is pre-treatment area, before we really commence the treatment to the patient. Second area is during the treatment, when the patient undergoes the treatment, they do need a lot of help from all of us. Third, an area to see immediately after the treatment and the patient, how do they really cope and what way we can help them. The other one is the area of health policy. Ultimately, whatever that we do, the health policy makes a lot of difference in the community as a whole, and which is a very important and factor to see. Let us see how, as an NGO, you can really bridge this gap and along with us, the oncologists. The first one, as I said, is the pre-treatment level. I will take you and then request to know how you can really expect. What do I really expect or need from in this area is in 3 important areas that I can really see. Area number 1 is the health education, which is utmost important and for all of us. Second area is screening camps. And the third area is a cancer care information to the people in general. So these are the areas that we really feel there's a need and a void and even at present with all the things done. So what is a gap that I'm really seeing in these 3 areas, even though it's very well known and going on and on? The first one is what education right now is happening in the cancer care is more of an opportunistic one. Either they will call you and for some talk and in one of the NGO group, or it may be school, or it may be some factory, they will call. But there is no systematic the program that we see. The second one is the screening and program. Even that screening program that we do is not really well organized on that particular case or that camp. It may be yes, but really speaking from the productivity point of view, is it really useful to the patient? Is not really happens. Third and one is breaking certain myths about the treatment. Unfortunately, cancer, if it says cancer is equal to death. Cancer is equal to suffering. Cancer is equal to financial ruin of the family. This has really come in the mind of everybody. Partly that is right. Otherwise, it would not have come. How do we really mitigate that? And that is where I really look for the role of major NGOs like yours, which can play a role in the pre-treatment area. How are you really going to play? One, I can really say, adopting a district, taluka, or a PHC or a CHC. And both, and it's for the health education and health screening and cancer information. In that way, you can systematically know whether you are really doing the educational program in the long run. It's not just for 1 year, 1 month. It must be almost a decade or more. Then only you can see the impact of the help that you are really assessing. And yours is all India level basis, you can certainly as well you can do that. So that is where I really see your role in that area. The main informations are in a dissipation. Dr. Patel has shown how we can really do the information to the patient. collecting all the information from the very well-known hospital, doctors, oncologists, and how do we really inform them. And today with the electronic media, and it is possible to do that. But it has to be authentic information and maintained by, because you're all empathetic to them, and you can do that. The people can really search and get the information whenever they want. That is have another an important. And coping strategies. It just the moment they hear the word cancer, and the whole family and gets shattered. So that is where the coping strategy from NGO can really help to come and help them how to go about it. The next one is during the treatment, what happens. During the treatment, the needs that I can see, when we really treat a patient, it's a compliance problem. Patient, and when we say radiation, they will have to come 6 weeks, and in between they just drop off. That is really very sad. When once they drop off, we know they are bound to come back with a second recurrence, and for them, and at that time it's very difficult to treat. And supportive care and for them is a very, very, very important. And many times they drop off. They come from Gulbarga, they come from Raichur, which is almost 500, 600 kilometers from here, and they can't stay. And for such 1 to 2 months, and that is where the NGOs have a lot more role to play. And the gap that I see as an oncologist is giving them a transportation facility. There are many government the schemes in which they give a sometimes free and sometimes very concession rate, but patients do not know that. How do we really make them to know? That information should be able to give them, and there's certainly a gap. Finances, certainly more talk about it. It's good, and how do we really generate the finances? There are umpteen number of resources to get the finances, but it has to be told to them and follow it up and see that the money comes to the patient and that their treatment is completed. That is a very important area. And then the bystanders. There are many bystanders in which they keep on talking. One patient may be having a cancer of the breast, another patient having a cancer of the lung. There are two different cancers, but these bystanders go on talking about the cancer. One may be curable, one may not be, but the patients will get confused. And NGO can really help them and guide them properly what information to be given. Like in the transportation, I said coordination and the staging and bhajana. They can really do when the patients are waiting, and there are rooms and where they can be counseled, can be done, and coordination for their accommodation. Let's say even in Bangalore, and our hospital in Double Road, in and around Double Road, where is with the cheapest accommodation one can get it, and that information can be given to them. So like that, I just gave one example, like that anywhere you are really doing the work, and that kind of information is required for the patient can really be given. The next one is regarding the post-treatment. After the treatment is over, in a cancer, it doesn't end there. In fact, there are many, many steps and which has to be taken, and in my opinion, it's a continuum care. When once the cancer is affected, it cannot be just say, my treatment is over, you can go back home and nothing is need to be. Rehabilitation is the most important aspect, and for them, how do we really bring them back to the mainstream of the society, and that is a need and which is required to the patient. Social support. The moment we say that there is a patient is treated for a cancer and is looked upon as if he is something untouchable. So that kind of a thing should go. And today, do we see that anybody with a diabetes or a hypertension, we call them like that? Never. It's the same way, and it is one of the disease. And that is where I really see a gap and a compliance program of a continuum of the care, and the NGO can really take up. If you are assigned to one hospital or one clinic, and you can see that this patient really comes for a follow-up, or and with the doctors, and whatever the information is given by the oncologist. Employment opportunity. We cannot really brush them off just because they are cancer patients, they are not employable. There are several avenues which can be created and told to them, look, your job, the employment opportunity is quite possible. All of you are such a powerful people. You can even approach the employment, the Exchange Bureau and see that these patients are really called and the employment is given. They do need, because they have taken a break and for their treatment and from their family, and they do need their employment continuation of that. Then the social education. When I say social education, educating the public, do not call them as somebody and who cannot be touched. Cancer is not a contagious disease. Please, you make it a point to inform everybody, cancer is not a contagious disease. Same dish that you use and your people were using earlier, same plate, same spoon, same glass, everything can be used. It will not infect the other. Even in their own home, and people, when once they come from the cancer treatment, and they want to keep the separate cup, separate mug, separate plate, no. For heaven's sake, that kind of a thing should not happen, and social education is a very important part, for them to take it. And that is where NGO can help in counseling the patient, in a goodwill for employment creation or getting back their employment, and education, the awareness program. Another important part that I would like to stress, on a matrimonial bureau. There are a matrimonial bureau meant for cancer patients. In fact, I was surprised. It is available in the website. You can go and see matrimonial bureaus available for cancer patients. Hats off to them. Hope it is a very genuine one, and such kind of a thing should happen. It is not that just because they have cancer, they cannot get married, or their children cannot get married. And there, your education is a very important role NGO can really play in that score. Lastly, and health policy. In the health policy is the one which really makes a large impact to the people. And if the health policy of the government is whenever it is announced, the public should really react. They announce, but hardly see any public reacting to those health policies. We have seen 50 crore of people is now insured and for all the diseases, and there's hats off to that, and so that people can get the treatment and for cancer plus other diseases too. So, but in those, the policies are when announced, one should able to, our association should able to interact with the government and see where the lacuna really lies and how can we change the policy. Another example I can give you is a tobacco control program. It is all of you should really voice, and why not? If only one tobacco is removed and from our country, and how much we are going to save? Almost 55% of the cancer only will be cured, or we will not going to see the cancer in India. So that is the kind of the impact that you can make in the policy. So in the policy area, and it need to be in the tobacco control and viable health policy, and and vaccination scheme, particularly for the cancer of cervix is quite common here in India. Almost 18 to 20%, in some places 30% of the cancer of the woman is going to suffer. If a child is vaccinated and between the age group of 9 to 14 years, and the cancer of cervix can be prevented. Such amount of the information is available. We must push, NGO must push the government to make this as in the policy of the vaccination as a compulsory. When it becomes a compulsory, and then automatically cancer of the cervix can really be eliminated from our country. And that is a big impact the NGO can really do, and a good service to the And establishment, cancer establishment, the facility. In India, we don't have a white paper at all. If I want to start one, outside this place, I can start a cancer hospital, and next door another person can start a hospital. There's no white paper. That is the reason why we see more of a cancer centers in urban area, but we are not seeing tier 2 and tier 3 cities. If the government really has a plan, and a 5 years, 10 years plan for the cancer establishment, and that can come, and that is where the associations like yours and can play a major role and in this control and program. The financial viability, why I'm saying the financial viability, health insurance schemes are coming now. and only one or two, I see the health insurance scheme wherein they cover the cancer. Why not all the other schemes? That we must insist, and NGOs must insist, and health finances and must be, part of the health, coverage, and must be there. So, and there's a good creation of the information to the public, and today it is possible by various means and of the electronic media available. And just today morning, we have heard how a yoga and meditation is helped, and we have also done one good one program, or the scientific program that we did in our hospital, and how during radiotherapy, and how when yoga and meditation was introduced, how did it help the patient, particularly in their general well-being. So there's a lot more thing NGO can certainly work along and with us. And finally, I end my talk with only one word, with our Guruji always says, that is, we have all, God has given us the biggest message. We are not here only for ourselves. It is meant for others. So, but unfortunately, the chartering of our mind is such, we get bogged down with the day-to-day work, but we forget over the bigger picture. All of you are really blessed and working for others. I wish the NGO good luck, and these are my points for you.
Thank you
So much.